Right. So we head on to the next component, that is known as mood and affect. Okay. So what is mood? Mood is a feeling that a person feels at a particular point in time. So when we assess mood, so see, it is very subjective. That means it varies from person to person, and it will vary from time to time. It will not remain constant. So always remember that when we assess mood, we do not want to ask what the person is feeling at that particular moment in time. Okay, we want to ask how the last 7 to 10 days have been. Okay, how, so it is a overall picture of the mood in the past 10 days. So we ask the patient, over the past few days, how was your mood? Now there is a lot of chance that the patient might not understand what we are talking to, what are we trying to ask them. So we also have to give them some cues, like and also it is very difficult when we ask in Hindi, right? So what do we say to the person to the patient when we are trying to assess mood? पिछले कुछ दिनों में मन कैसा रहा है आपका? We are talking about मन or mood. So don't ask कि अभी मन कैसा है आपका? When we ask this type of question, or when we say that how are you feeling now, will be affected by various things. The mood will be happy because someone has gifted him something. Mood will be sad because something bad has happened, or someone might have said something to him or her. So that is why we ask mood for an overall period, for some few past few days, that is 7 days, 10 days. We ask how was the mood, and then we have to give them some ideas. Were you happy? How was the mood? Was happy, mood was sad, irritable, angry, suspicious. So the person will think and then come to the point that how the person is feeling. So a person might say that okay, over the past few days I'm not feeling that well, I'm feeling very low, I'm sad. Okay, so this is mood. So this is dealing with emotions. You might have understood by now that this is dealing with emotions, and emotions are two types of emotions, no? When we see primarily positive and negative emotions. Also, when we are expressing the emotions, there are two components. One what we are feeling, and another is what we are expressing. So when we say that okay, we are sad, that sadness also reflects on the face. It is very difficult to smile and say that okay, I am sad. It won't happen like that. Okay, so that is known as affect. Remember, this is AFFECT, not EFFECT. Effect is actually cause and effect. This is affect. This is outward expression of the emotion. So outward expression of the emotion is called as affect, and this mood actually affects the affect. So what we are feeling is actually being projected out, that is on the body language, or primarily on the face. So when we talk of affect, we say that the affect is appropriate, or the affect is inappropriate, or the affect is flat or blunt, right? So and many times we also say the affect is incongruent, it is not matching with the mood. So if a person is saying that the person is feeling, over the past few days the person is feeling happy, and the person is also smiling and telling you that oh yeah, I am very happy for the past few days, all things are happening in a very smooth manner, I am very happy, I am taking my medicines, I am feeling good, and you can see it on the face. So in this case we say that mood and affect are congruent, or mood is or the affect is appropriate. Okay, or there can be another case where the person is saying yeah, I am very happy, very happy, I am very happy, yeah, things are going nicely, I am very happy, but the affect is neither happy nor sad. So this is called as flat or blunt affect, where the person will talk with a straight face, no expression of any emotions will be there. Okay, so this component, mood and affect, primarily deals with emotions. Point to remember is that in mood we are actually talking about the past 7 to 10 days, and effect we are seeing congruency, that whether the mood and effect are complementing each other, whether the person is actually showing the right kind of mood that is being expressed. So this is the component of mood and effect. Now let's move to another component that is known as perception. Okay, so what is perception? In psychology, when we talk of perception, we have to understand about sensory system also, right? So when there is any type of sensation, okay, any type of sensory information, and with that sensory information when we attach interpretation, it becomes perception. Okay, I'll repeat myself. When we have sensory input, sensory stimulus, and with that sensory stimulus we attach a interpretation or a meaning, it becomes perception. For example, you hear the voice of a horn outside, okay, by just listening to the horn you may be able to relate and tell what kind of vehicle it might be. Okay, 90% of the times you might be right, sometimes you may be wrong. So if it is a single horn, small horn like kiki, you will understand, okay, this is some type of either a bike or a scooty, right? Or sometimes if you hear a big horn or a air horn, you will understand that, okay, this is a truck. So you are getting an auditory stimulus and you are attaching a meaning to that stimulus, and because of that you are able to assess or tell what kind of stimulus is, or what kind of vehicle is going out. So this is called as perception. So always remember, sensation plus interpretation is equal to perception. Now many times there is error in perception, and these errors in perception are classified as hallucinations and illusion. Hallucination and illusion. Now let's talk of hallucinations first. So in psychiatry, hallucination are part of symptoms, especially this comes under psychotic symptoms, where the person is detached from reality. The person does not have any link with the reality. So there are many disorders, especially schizophrenia. In schizophrenia, the person in the symptomology, the person will have hallucinations. Okay, we had talked of delusion also in thought. So delusion is also one of the primary symptoms of schizophrenia. Similarly, hallucination is also one of the symptoms of schizophrenia, or in fact any type of psychotic disorder where the person gets detached from reality. So what is hallucination? So what did I tell about perception? There is sensory stimulus, we attach a meaning to the stimulus, it becomes perception. Now in hallucination, there is no sensory stimulus. Remember, in hallucination there is no sensory stimulus, yet the person is able to see, feel, or sense that stimulus, and that is why it is known as hallucination. Okay, so this is a false perception in which there is an absence of stimulus or stimuli. Understood? So how many types of hallucination are there? There are many types of hallucination, right? But primarily at the beginners level, we will just deal 5. Easy to remember because we have 5 senses. So that is why you can say there are 5 types of hallucination. So first is, you just count your senses. First is vision, that is known as visual hallucination. Another one is smell, called as olfactory hallucination. Hearing, called as auditory hallucination. Taste, called as gustatory, and touch, called as tactile hallucination, or sometimes haptic hallucination also. Right, so these are the 5 primary types of hallucination that a person feels. Now what are these? What is visual hallucination? Person will see something that is actually not present. the other people will not be able to see that thing. Okay, so the person will say that, oh, I'm seeing some colors, but other people might not be able to see those things. Primarily happens in substance abuse disorder. Okay, people who are using a lot of drugs, okay, hallucinogens and all those things. So there we see hallucination, visual hallucination. Auditory hallucination. Auditory hallucination is person will be actually hearing sounds. In most of the cases, the person will actually be hearing sound of drums, okay, beating of drums, or the person will be hearing two people talking, okay, continuously talking together. In some of the cases, the person will be hearing sound that is actually commanding this person to do something. These are known as command hallucinations. Okay, where the person is getting commands from some other voice to telling him to do something. Then there is another type of hallucination under auditory, which is called as running commentary, right? So whatever the person is doing or is about to do, it is actually been heard in his brain as a running commentary. Oh, he's going to go there, he's going to now wear his slippers, see, he has worn his slippers, now he will go and pick up the knife, he'll start cutting. This is what is happening. Whatever the person is doing is actually going on as a commentary, just as a commentary in sports. So these are the types of auditory hallucinations. Then olfactory hallucination, person will be able to smell certain things, and the other people will not be able to have that sense of smell. They might not be smelling things, but this person who is experiencing hallucination will have a lot of odor or fragrance, depending. And then gustatory, again, some people will complain that ants are running. That gustatory is taste. So the people will complain of false taste, foul taste, right? Tastes that are not not are not very common. And again, tactile hallucination, those type of hallucination where the person will complain about insects or bugs roaming on the skin, or sometimes snakes crawling on the skin, but in reality there is nothing like that. Okay, so what is hallucination? Hallucination is false perception in the absence of stimuli is called as hallucination, and there are 5 major types, 5 primary types that are related to the senses and that we have seen. Another type of error in the perception is called as illusion. It is very common, and this illusion usually happens when there is heightened state of emotion. When we are emotionally very charged, many times we will get these types of illusions. There are other type of illusions also. So first type is affect illusion, when it usually happens when we are very emotionally charged up. So suppose when we are afraid and we are entering into a dark room, every other thing, or we'll be very sensitive to any sound that is coming or any movement that is happening, because we are at a heightened stage of emotion. And because of that, every single thing that is happening will capture more of that particular stimulus. Okay, so suppose we go to a room and which is dark, and on a hanger we see a shirt which is hanging, and we look at the shirt and we think, oh, there might be someone who is standing there. Okay, so this is known as illusion, where illusion can be defined as misinterpretation of a stimuli. It is defined as misinterpretation. There is a stimuli. In hallucination there was no stimuli. In illusion there is a stimuli, but we misinterpret the stimuli. Suppose a rope is lying or a pipe is lying and misinterpret it as a snake. Okay, so this is known as effect illusion, right? And there is also a condition known as pareidolia. You all must have seen at some point, or sometimes we see figures forming in clouds. Sometimes we say, oh, see, there is a face in the cloud, or we say, oh, see, there is a horse in the cloud. The clouds are making some figures. right? So these things, when we see faces or images in clouds or scenery or rocks, these type of things are known as pareidolia or pareidotic illusion. Okay, that is misinterpretation of the stimuli. And the last third type of illusion is known as completion illusion. So completion illusion, what happens is, we see an incomplete image and our brain tries to fill that thing and make a proper good image out of it. We see a broken house and our brain tries to fill the information and we'll see some other thing forming of that house, right? So this is called as completion. So anything that is incomplete, our brain tries to fill that information, and once it fills the information, we perceive it in a different manner. So these are two type of perceptual disturbances or perceptual disorders which we commonly encounter in patients, and these are known as hallucination and illusion. Okay, so we'll move on to the next component now.